Okay. Assalamu alaikum. This is a case. We have a try-in in a denture. We had problems in the previous denture, and one of them was non-retentive posterior upper denture. How am I going to solve this? If I'm going to solve this, what in the first time you done it anatomical. You simply drawn something between the two hamular areas and you drawn it anatomical. Yes. Here we drawn it from the inside the patient's mouth.
And we didn't extend it anterior to the hamular.
So we increased the anterior vibrating line in the butterfly shape. We reduced this, and we also increased the seal here because she has a very shallow tuberosity. So we don't end our carving in the hamular area distally. We also end into up to the zygomatic process. Okay, we extend it anteriorly, incorporating the whole tuberosity in the seal line. This will increase the posterior seal. Okay, we don't have a posterior seal enough for this. Now, the second thing that we noticed inside the patient's mouth, that this is the old denture, and we're repeating the upper. This is what you were indicated to do. Now, this is the bite inside the patient's mouth. What we found that this is biting higher than this one. Okay, see the bite on these teeth are higher on this side. The question was, do I increase or decrease? If I had a good vertical dimension, I increase this side. Okay? If I had a high vertical dimension, I reduce these. So this is putting in vertical dimension into adjustments. Which one do I use? And definitely I recheck after adjustment with the Fox plane. Okay? Yes. Another question was that this here, is it changed on the cast or inside the patient's mouth? This is what our question. So this articulator, when we place the upper here, can you place it please? Okay, leave it as it is and close it as we found it. And this is why we're doing this video. We found that this has been indicated for a unilateral crossbite. The idea is the occlusion is ideal on the posterior teeth. Okay, so on the articulator is correct, but inside the patient's mouth is high. But I told you to check something, which was what? Any wax on the articulator. Now, take this denture out. We noticed when we removed the denture that there was wax in the sulci. What does this wax cause? It causes unseating of the base plate. So you see it on the articulator that the teeth are in bite, but if I remove this wax, you will begin to see the space that is deficient in the occlusion. So where do I adjust it? Do I adjust it in the patient's mouth or on the articulator? On the articulator, because I solved the problem. For example, in this case, we have wax in the sulcus. This is preventing the base plate from going down. We even have wax here. Yes. All of these are preventing the base plate from going down. Once I remove all of this wax and de-wax this, the base plate will be better positioned, and now I see the space between the upper and the lower. Sometimes it's a loose screw, for example. Sometimes it becomes a loose screw. When I tighten it, I see what's in the patient's mouth. I see it as a space here. So also I adjust on the articulator. No need to use the patient's mouth. Also, sometimes these are displaced from each other. Sometimes they're separated. Sometimes the material is not well seated. Sometimes I find a rock or something in beneath it. All of these are articulator errors. So I adjust the articulator. I see what I see in the patient's mouth. I see a space now here. Then I adjust the putting down these teeth up to here. Now suppose everything was correct. Everything was seated. The occlusion was perfect here, not in the patient's mouth. I adjust tooth by tooth in the patient's mouth. I take out the tooth, for example, this side. I take it out, drop molten wax there, and re-put it, and let the patient bite on it. Then do this and this and this until one by one. I wipe all of the colors again and repeat the check and see that they are equal left and right. And by the way, this case in the patient's mouth, she feels that she's biting here more on than here. Okay.